Good afternoon, everyone. Thank you for joining us today, where we can hear the latest updates as it relates to COVID-19, of course, the vaccine rollout in our community of Contra Costa. I want to thank everyone for making the time to enrich yourself and learn. As a reminder, this is an interactive session, so if you'd like to add your questions to either the chat or the Q&A, we will work our way through those. But we're going to start today. I'm going to toss it to Heather Sederma. Did I say your name right this time?
Totally correct, yes.
All right, point for the day. I'm going to turn over to Heather Sederma, who's going to be chatting with us about sort of where we're at in the process and who's agreed to really be our leader in this process. So thank you, Heather, for making the time. Look forward to learning from you today. I'm going to toss it over to you.
All right, thank you, Nicole. Thank you for having me. I am, for those who were here last time, thank you for having me back, and thank you for coming back again. And for those who were not, I am a nurse practitioner. I work with Contra Costa County Public Health Department. I've been there for 20 years as a nurse practitioner and provider, most recently embedded with healthcare for the homeless. And I've done a lot of work with the COVID response from the very beginning, just about a year ago when we first knew that we had cases of COVID-19 in the United States. And then when we had the shelter in place in March, so we're really coming up on an anniversary and have been part of the process and a witness to history and what happens when public health tries to meet the moment in a pandemic. So my goal is for you to have questions that you have answered, provide information that you didn't know that you wanted to know, but you realize you need to know. And then just to hear from you and answer any questions that you might have. All right, so here's the overview. Contra Costa County today. We'll go over vaccines and just back to the basics of what vaccines do and how they save lives. How to make an appointment, right? The logistics now. Everybody likely knows they want a vaccine or don't, but it's what happens in Contra Costa County when you make an appointment, how to make an appointment, and logistical questions and reliable resources that you can go to get answers if you need to. So here we have the big picture in Contra Costa County. This was updated yesterday, and we have just gone down, 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 down. We had the surge that started around Thanksgiving, and we were up nearly 1,000 cases per day. And we have come down considerably. This number right here, these are the numbers and the metrics that the decision makers may use to decide, can we let people, are we a stay-at-home order? Can we open up schools? Can we open up businesses? And they look at these and they use these numbers to help them calculate. This 21.7 is an important number. That 21.7 is the number of cases per 100,000 residents in Contra Costa County. And that 2 weeks ago was at 66. Then it was at 33, and just this week. So 7 days, 14 days makes a huge difference. We're a third of what we were 14 days ago, which is wonderful. 5.7. So for every 100 tests that we do, COVID tests that we do in Contra Costa County, 5.7 people are positive on those. So that's a really good number. We want that down at 0, of course, but we want it below 3. If this number 21, if this becomes 7 cases per 100,000, and this is around 3 cases, well, under 7 actually, we will go from what we call the purple tier, which means that there's stricter guidelines on restaurants and gymnasiums and hair salons. If we get to go down on these two, then we will be a little more open and we'll go into what we call the red tier. So this is good news, and this is where the decision makers go to get their information, or the information they use, so you can see that. The basics again, vaccines save lives, and we're so excited to have a vaccine. The vaccines have saved more lives. It's that scientific advancement that has saved more lives than any other scientific advancement in the history of the world. And COVID-19 vaccine is one of the new ones that will save more lives, probably than any of the other vaccines in an isolated moment in time. Of course, smallpox, measles, all of those are really important. Polio are really important vaccines in a time, but COVID-19 is the vaccine of our time and of the moment. We have the technology on the vaccine that's out right now. There's the mRNA, and the mRNA is that vehicle vehicle that carries in that little COVID spike protein that's been deactivated that helps our body meet the COVID-19 virus in a deactivated form and helps our body learn how to fight against it and produce antibodies. Johnson & Johnson, so the next type of vaccine is at the FDA right now, and we think that they will make an assessment, and we are hopeful that they will approve it for use in the United States around the end of February. We don't know exactly when that will be, but we're hopeful, like everybody else, that around the end of February we'll have one more vaccine in our toolkit, and it is the Johnson & Johnson and the AstraZeneca are more stable and don't need quite as much what we call cold chain supply and deep freezers to keep it stable. So it will make the vaccine even more accessible. One reason, because it'll be one more manufacturer. So we'll have Pfizer, Moderna, and Johnson & Johnson, and also because it's very stable and can go more in the refrigerator than the deep freeze that not everybody has. And the big deal about vaccines and why we think it's good for everybody to get one, no vaccine, no treatment is ever 100%, but we know that it prevents severe illness and death. And so COVID vaccine, if you've been once vaccinated, you have a certain amount of protection from the disease. Twice vaccinated, it's most certainly that it will prevent severe illness and death. And that's been across the board. And so we're really, really excited about that. Who should get vaccinated? Everyone should get vaccinated. This question comes around in different ways each time. Like, if I have asthma, should I get vaccinated? Yes. If I have autoimmune diseases, should I get vaccinated? Yes. If I have multiple sclerosis, cancer, any other heart disease, CHF, should I get vaccinated? Yes, 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 absolutely. Because getting COVID-19 is a far greater risk than getting a vaccine that might make you a little achy, but absolutely. The vaccine does not give you the illness and does not put you at risk like getting the disease does. So yes, 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 you should get vaccinated. And again, here's that vaccine series, prevent severe illness and death from COVID-19. Very exciting. And I didn't present this last time, but you may have heard that we don't want you pre-medicating. Sometimes with kids, people used to, but it's not advised anymore. They would give Tylenol or ibuprofen before you went in to get the vaccine because you thought, oh, it might hurt, I might get a fever, might do something. Don't do that, because we think it might blunt the effect of the vaccine, and so it might not make your body respond quite as much or robustly as we would like you to. So wait, don't take Tylenol, ibuprofen before you get vaccinated. Later on the day, the next day, if you have a sore arm, if you're really uncomfortable, then go ahead and take it, but don't pre-medicate yourself before with that. The most common side effects, day of the vaccination, expect about 15 minutes after your shot, because some people might have a severe allergic reaction. And that's really quite rare. We think maybe 2 in 100,000, 3 in 100,000, but very rare. But it does happen. And so then you'll be screened when you are there. They'll ask you some questions. If on this phone call, screening call as well, if they feel like you might be at risk, they might ask you, or they might schedule you at a place that would be able to accommodate it better than a mobile site or something that couldn't quite do as much for you. So we want everybody to get it. You'll always be monitored after. And here I put these, we've actually are up at about 164 million vaccines in the world. I didn't update this slide. So add 100 million to that, and that's pretty exciting. So lots of people have been vaccinated. We have lots of really good, reliable information now on the vaccines and their safety and their efficacy. Expect a little pain at the injection site. My dad, who's 86 years old, he got his vaccine a couple of weeks ago, and he was, nope, I'm fine. And then he actually slept for a few days. He was up and down. He's like, gosh, I'm tired. And I said, that's because of the vaccine. And he perked right back up again. So every body has a different type of reaction after the fact. His arm didn't hurt, but a few days later, he's like, gosh, I'm tired. And he just like hung around, felt like a lazy guy. And now he's perked back up again. So no, and don't worry, but even little kids, if you remember your children, we would say when they got their vaccines, a lot of times the day of, they're a little fussy because it hurt. Second day, maybe a little bit. And then a lot of times a week later, because that's when the antibodies are starting to really mount and your body's really active on the inside. And so that's what happens. And that's why you might have some fatigue or some late, what we would sort of call late effects from the vaccine, but they're good effects is what they are. How to make an appointment. Making an appointment to get vaccinated. There's 3 ways that we want to encourage you to make an appointment. We'd love to first drive everybody to the Coronavirus Health Get Vaccinated to the website. So this is our computer. Go on the website. There's web form that you'll be able to get vaccinated. And we can go back and forth through these if people would like to see these a little bit more. There's a phone number for those people that don't have a phone, aren't able to, you can have a phone but don't have a computer, go ahead and call. There's a call center. You might be a little bit of a wait on the call center, but we're doing better. We've got more people. And so there's phone number, there's computer. And if you're not able to do it, if you don't have a phone, if you don't have a computer, try to get, there's friends, community members, neighbors, there's heroes, there's people in the community that want to help. You've got the people on this phone call, perhaps your advocacy people. You can say, listen, I was at an event and they told me you can call this number. Can you help? So go ahead and ask. We really are trying to encourage neighbors to help neighbors, friends to help friends, community members, right? We're all in this together. And if you're protected and safe, then I'm protected and safe. And we really want to support that community outreach and effort to support one another to get vaccinated. And here it is, be a hero. And if you got your vaccine, help somebody else get their vaccine. Really do one, see one, teach one. Go ahead and get your vaccine, help somebody else get vaccinated, and they will in turn maybe help somebody else get vaccinated. And there's this is a link from our Facebook page. And so if you're modern and tech savvy, go on the website or follow us on Facebook or Instagram, and they've got these links and you can click into these links. But we've heard some really wonderful stories about community members helping community members and taking it on themselves in their older adult communities, helping people getting a vaccine, reaching out, helping the neighbor, helping somebody get there, drive there, get transportation there, whatever you can do. If you do it for just one person, that if everybody could do it for just one person, we would be on the road to opening up and no COVID anymore if everybody could help one another. The vaccination link. So what you can expect if you go on to our vaccination site is you'll submit a form. And actually I say on ours, on Kaiser and John Muir Health, everybody has some form of a link that you might go onto or a message internally to make an appointment. Submit your form. You'll likely receive an email saying, we got your request, and you will have, you'll need to fill that out. And this is one of those places where perhaps you need to phone a friend or ask a neighbor or a community member to help you with this because you can't find the link that they sent. You don't know how to navigate that. You're not alone in this, and don't be ashamed of it, and just go ahead and ask somebody else to help. And we want you to be able to, or pick up the phone and call and say, listen, I got this link and I can't do it. And that's okay too. Now, answers to questions. So we're going to do a question and answer, but these were a couple of the questions that were really good for me to hear. And it was really good because then I reached out to the vaccination branch and talked to the organizers and the directors of it and said, okay, these are really good questions. What are your answers? So first interesting information that wasn't asked, but it was good for me to know. Early arrivals are not seen early. So if you have a 10 o'clock appointment, do not get there at 9 o'clock because you won't be seen before your time. Everybody is taken in their time. So they recommend do not come in early because you will be standing for that much longer if you go in early. They recommend do not come in more than 10 minutes before your appointment, or go drive there, sit in your car. But then when it gets about 10 minutes before your appointment, then you can go get in line. They say that it takes about, let's say you had a 10 o'clock appointment, you then go, you get there, you register. It's about no later than 10:15 that you would get your vaccination. You'll wait for that 15 minutes. So maybe 30 to 40 minutes you can expect to be at the site if you get vaccinated there. And that's they've got a really well-oiled machine now. They're getting better and better. And that's pretty much standard. Actually, across California, we're seeing a lot of efficiencies in this, and expect about, again, 30 to 40 minutes at the most. And as we get better and better, there have been some people that were in and out in less than a half an hour. All vaccine sites are accessible for mobility and sensory impaired. They're ADA accessible. Some are a little bit more than others, but all of them have that access. And if you're on the phone and you need special accommodations, let's say that you're visually impaired or you're deaf, somebody makes that appointment for you, please let them know, or you actually have mobility issues. They will either direct you to a site that might be more accessible for you, but they'll definitely know that you're on the way. So let them know, and they should have accommodations for you when you get there. West County Richmond Auditorium is the preferred site for mobility impaired because it's a big, expansive, and they have more facilities for that. Again, all of the sites are able to accommodate, but the Richmond Auditorium in West County is actually the preferred site. We think you'll be more comfortable at that site if you have issues. The question was, will you need ID to get vaccinated? They prefer that you bring a vaccine because they want to make sure that the person that they have registered is the person that's getting the vaccine. And so they prefer to see some sort of photo ID. If you forgot it, if something happened, then what they will do is they'll ask you some questions. What's your birth date? What's your address? What's your phone number? Something so that they can validate that you are the person that they're vaccinating, because they don't want Joanne Smith. They don't want the other Heather Siderma, I'll say. So two Heather Sidermas, they want to make sure that I am the Heather Siderma, that's my birthday is this date and this is my address. So they'll ask you some validating questions if you forget your photo ID or ID that can help them identify who you are. We are absolutely vaccinating people that do not have a steady address, so you do not have to have your vaccine, but you do have to, again, have information that they can validate. So they won't just take Heather Siderma. I need to give them something else, my birth date. I can give them a mailing address, but if I don't have one, I can say homeless on it, and they just want to make sure they have some information and a way of getting back to me. So it is not to be the man and track you down, but it is the way to make sure that if we need to reach out and provide extra support, make sure that I am the same Heather Siderma that got that vaccine. We want to make sure that we're getting the good information to be able to follow up. Undocumented are absolutely welcome. We want absolutely everybody who's got boots on the ground here in California, Contra Costa County, to get vaccinated. So immigration status does not matter at all to us. Vaccine is safe for everyone, and I mentioned this before, even people with chronic disease, and especially for people with chronic disease because they're at a greater risk of having adverse events from COVID-19. And while we say that, asthma, chronic lung disease, and everything like that, it really is, age is the greatest, I don't want to call it a problem, but the greatest risk factor for having a bad outcome from getting COVID-19. And so we want to make sure that everybody gets vaccinated, and as we have done in the priorities, especially our older people first if we can, right? Because that's the group that has suffered the most. People with transportation issues, health plans often help with the transportation arrangement. So if you can make an appointment a week in advance and you've got Contra Costa Health Plan, you can call the health plan and ask, say, I need support getting to my appointment, and they might send Uber or Lyft. They'll make arrangements to help you get transportation. If you are really having trouble and say, listen, I need this appointment, but I can't get in, they may be able to provide some solutions for you when you call to make that appointment. So let them know if you need to. And that's where you reach out to your community heroes and see if somebody might be able to help you get to the appointment. These are the Help the Neighbor campaign, and you're a neighbor, and if they can help you and you can help them and pass it forward, we really are recommending that. These are just the little bits. Be informed and educate yourself. Know the risks of getting it. We still have to wear our mask. It's those basics we can't forget. We're getting so much closer. The surge is we're on the other side of that surge. Hopefully we're on that hill that's going downwards, and we don't pop back up again. But if we don't keep wearing our masks, we could spread it. We know the virus in unvaccinated people, that we think it really grows and replicates for up to the 7th day. It could be longer if your immune system's not as hardy. So we really think even if you don't get sick with it, it might be something in there in the reservoir, and you might be able to pass it to somebody. So keep wearing your mask, keep washing your hands, don't sneeze and then pass it on. Make sure that you wear your mask, still keep your distance. Know the facts about the vaccine, that it does save lives, that it does prevent illness, that it does take a while for it to be as effective as we want it. We do need both vaccines of this Moderna and Pfizer to have that full 95%, but we definitely know that there's close to 77, 85% protection even without the second one. The longer out you are from that vaccine, it's about 2 weeks to really get up to the 77 to 85% protection after that first vaccine, but that second one kind of boosts you. The Johnson & Johnson, we think the longer that after the vaccine, that it will be more effective. And there's potential later on that we'll realize that we need a booster. They're doing those testing right now to see if it's necessary. And here, that question again, no, you cannot get COVID-19 from the vaccine. It doesn't, COVID-19 lives and loves your lungs and your respiratory tract. We're injecting this into your arm, and we're just presenting it to your body so that it knows what to do should it be introduced with that, and it helps build the immunity. So those are just a couple things. They're safe, they're effective, and they work. And here again, prevention is still our best tool. So while a vaccine is important, it is just another tool in the toolkit. It's good practices. It's keeping your distance. It's knowing if you're sick to stay home. It's washing your hands. It's using best practices. That's the way that we're going to keep it from resurging again. And even in the future, the next time that maybe it's not COVID, maybe it's something else. It's flu season. Even during flu season, the things that we have done now to help prevent COVID-19, flu this year is down 95% in Contra Costa County. So we've barely seen any. And that's because we're all doing the right thing. We're washing our hands, we're keeping our distance. We do have that immunity on board because we've had it in the past, but we're doing a great job. And so we wonder, a lot of people kind of suppose, will we be wearing masks every winter just because we know it helps us stay safe and helps us protect others during flu and cold season. So best practices, every day matters, every place matters. Everyone must do their part. If you see somebody you haven't seen in a long time, as much as you want to hug them, just give them a wave and just tell them how much you want to hug them, but don't do that. So really, we think until we really get this mass immunity up, that we need to keep adhering to these really best practices. Again, the way to get connected to us, the phone number and the website. And if you have symptoms or somebody you know, like if some grandchild, friend, somebody says, oh, I got a little runny nose, I want to come visit, recommend that they go get tested first. And once they're tested negative, then they can come visit. But still, we want people to get tested if they feel sick, get vaccinated if it's their turn to get vaccinated. And that's that. Thank you very much. Any questions you have, let me know. We can go back through the slides, and this has got the Facebook, we can click on there. So Nicole, what have you got?
Thank you so much, Heather. I appreciate it. I want to invite everyone to drop their questions in the Q&A or the chat. If it's something you're like, gosh, I feel kind of embarrassed to ask that, no need, but feel free to drop it in the Q&A because I will not say your name and only I will know. So it's all between friends here. Drop your conspiracy theory questions. Drop your my cousin had a question. Put it here. We want to get it answered. This is the time. We have Heather. Let's make sure to get it done. So Heather, we do have some questions, and I want to start off. It's this real question I know the county's been wrestling with. Okay, so the county's doing vaccines, but providers like Kaiser and John Muir and Sutter are also doing vaccines. And sometimes it's a wee bit confusing. So how can we help our clients to receive the vaccine when their insurance provider is saying, oh, they're not getting back to them or they can't get on the list? What do you recommend our course of action is?
So right, there's the pecking order. Everybody wants to be able to get it as soon as they can. We hope that you will try to go through your health home first, because if you're Kaiser, if you're Sutter, if you're veterans, because we think they've got it allocated for you. But if they say they can't, we absolutely want you to come to the county, fill out our form, have somebody help you, or make a phone call and try to get a vaccine through our website. Does that? And so we think that's really important. It's frustrating. Again, we still have scarcity of resources. So we're still getting 15,000 doses a week at the most. And so those have to be spread out between those that are getting their first dose and their second dose. And so Kaiser, we think maybe gets around 2,000 doses a week. Sutter, I don't know. And the VA is working on their people. So try to go to your health home first, because we think they've got an allotment for you. If they don't, absolutely don't hesitate. Sign up and come onto our website, and we'll put you in the queue. And they're prioritizing if you're 75 and older, because you were first on the list. It's like an airplane. The people that are supposed to board first, we want them boarded as much as possible. And then once we think they're satisfied and not boarding, then we get the next people. So it's 75 and older are going to be weighted and prioritized, 65 and older when that comes up. And then when we start opening to others, it'll still be 75 and older. We'll have that preference. But the other people will be filled in the slots around 65 and older. But don't wait.
If I filled out the form with the county, but I haven't heard, at what point do I start getting on the phone? At what point do I fill it out again? How should we handle that? Because people are really panicked. So they feel like they've done the form and they're not hearing back. Can you talk about what they should do? And then can you talk to us about, once you schedule the first appointment, and I know this from experience, you don't schedule both at the same time. You schedule one and then you schedule the other. So can you talk about that a little bit, about the process?
So once you schedule the appointment, so first off, ask the first question again. I want to make sure.
Basically, like if I filled out the county form and I fit the parameters, but I haven't heard back, and I'm super anxious and I'm nervous. At what point do I hear you saying that you're going to get an email then to set up the link, but it might take some time. How long should I wait before I start freaking out?
So hopefully you're going to get the link that same day. And sometimes it doesn't come the same day. Say someday it can take a day or two to get the link back. So it doesn't always go out immediately. It might come out. So let's say give yourself about 2 days to get that link. And if you don't get a link, then you could call, right? I don't want you to go and fill out another form. But if you get the link, give it a day or so, you fill out the link, give it a week before you are calling on the phone, right? We don't want you filling out a new form. We do want you following up with a phone call, and we want that about a week later, okay? Okay.
And when I do call, I should be nice to people on the phone and realize I'm going to have a hold, right?
You're going to have a hold. They're really good human beings trying to do their best. And I keep trying to advocate for that, because you're frustrated, they're frustrated, and we're not unique and the only people. So they really are trying to do their best. They have translation services. They've got lots of different things going on. So they're trying to do their best for as many people as they can. So be patient. It can take up to a week, even if you filled out the form, done absolutely everything right. It should take about a week to hear back, get an appointment scheduled. If you don't hear anything back and you've had those follow-up links or something like that, then get on the phone and give them a call and say, hey, I filled it out. And you'll give them your phone number, or you'll give them your name, and they'll be able to look you up and say, oh yes, we sent you a link or something. And they would try to manually help you get scheduled. Okay.
So what if I signed up with the county, had my first dose, had the emotional moment, and then after that, I get an email from my healthcare provider saying, hey, you're eligible, come on down. Do I stay with this county horse that I've been on? Do I switch streams? How does that work?
So you can, when you get, and this was a question from the previous one too, so you get the first appointment, you should be getting an appointment when you are there getting your vaccine for the next appointment. They don't make it at the same time because you might not show up, something might happen. So they always wait for that second appointment, and then they'll give you either the information, they'll give you the appointment, or they'll give you the information about when you will hear about that second vaccine. So don't fret about the two vaccines. Don't fret if there's going to be 4, 5, 6 weeks in between first and second dose. We've got you. They'll reach out to you for people initially. If they didn't have the second appointment when they walked out, they were calling and following up about a week before and saying, it's time for your second vaccine. So it is on the provider to follow up with you. We've got a list of people. If you get a message from from Kaiser, let's say, and you started with us, you get to choose which is more convenient for you. You do not have to stay with the same Contra Costa Health Services. Kaiser, you can tell Kaiser, I had my first vaccine at the county, and they will take and give you your second vaccine. They'll know in the system, and it drops in within 24 hours into their system that you have been vaccinated. So I'd say 24 hours after the vaccine, maybe 48 hours, it'll be on their health record. So you shouldn't hear from them that you need a first vaccine, but they will know that you need a second vaccine.
Okay.
Okay.
So if I'm helping my neighbor, my friend, my parent, and they don't have an email address, right? So I'm going to use mine, Nicole Howell is a princess at gmail.com. And then we're going to confirm their appointment that way. What happens when then I'm eligible for the vaccine? Would I have to then have a different email address? Like, can I help people with my normal email address, or do I need a separate, Nicole Howell vaccine setup at gmail.com to set that up?
You can use your email address. Absolutely. So it goes to the person. It'll say, here, Heather, you've got that. And so the email address is just so they can send you the link, because it's the link that they send you that you put the unique information in for your buddy, Heather.
So there isn't someone back at, Contra Costa Health HQ being like, oh, I've seen that email before and going to question that.
No, nobody's going to question that. They're going to love you. They're going to love Princess Nicole.
That's excellent to hear. So what happens if I care for someone who's 75 plus, right? And so they're eligible and I'm trying to get them taken care of, but I'm south of 65, so I'm not yet eligible. What about that situation? Because I'm a caregiver. I'm not an IHSS caregiver, but I'm an honest caregiver. I do it for a friend or a family member or a neighbor. What does that mean for me? Am I still just waiting for my age group then? And if so, what kind of verification could I provide that I'm a caregiver?
So they are asking, so they're gauging on this, and Nicole, you might know a little bit better about this, but we are asking for some validation that you are a caregiver. We had a 17-year, there's a bit of the honor system on this, but we are trying to, who is it that you're taking care of, right? Who is it, in what circumstance? And then you need to, people going in, if you want to get vaccines, this was a question I didn't add on this. Nicole, I am the person that needs a caregiver. Nicole is my caregiver. We don't automatically give it to Nicole because we're walking in together. Nicole will need an appointment at that same time. So we need to make those appointments together to be able to get the vaccine at the same time. You can push your person through, but you cannot just assume that you're going to be vaccinated. Everything is by appointments. And so don't be upset that they're not giving it to your caregiver. These are the rules. Everybody needs an appointment. So make the appointments together, go at a different time. Don't be upset about that.
Okay.
You can be upset about it, but be understanding as well.
So I can be upset inside, but not outside.
Exactly. Internally go through that.
Okay. That's rough. Yeah.
Yeah. And you had that question about, what if I'm an informal? Yes, we still want people that are informal caregivers to get, you can get vaccinated, you qualify, but they may ask some qualifying questions. And it's an honor system, but there is a bit of validation, like who is it that you're taking care of? What do they have? What makes them a person that needs your services?
Right.
Yeah.
So we're deep in Pfizer and Moderna right now, right? Those are the options sort of available. We think we're coming around the bend with Johnson & Johnson, and we hear about AstraZeneca, but it's whatever you hear on the nightly news. So now that there's more options on the marketplace, are there some that may be more appropriate for certain kinds of people? And if so, should we wait to get a specific kind, or do we jump on the first chance that we get? Are there any specific different concerns for the different sort of brand of the vaccines? What should I know?
You should know that take the vaccine that's in front of you, offered to you, that you can get to the easiest. That number one. If you think for some reason the AstraZeneca and the Johnson & Johnson, those are single dose right now. If you think you are not going to be able to get around for the second dose, then that might be a situation where you wait until there's you can get the single dose vaccine. And the issue with that, though, that we have right now is we don't know who's going to be giving those out. at the time. We don't know if each of the sites right now logistically is going to have Moderna, Pfizer, and AstraZeneca, or Johnson & Johnson. So a little bit of those logistics might be in the screening questions, like, do you think you'll be able to come in for both vaccines? And if you say no, they may screen you and say, okay, we're going to send you to this site that's giving the single dose only vaccine. So I think that's on our end, the upfront end vaccine branch, about sorting people into those groups. For you, if we've appointed you to a site, you go to that site and don't say, no, I want the Pfizer or the Moderna. That's not for you to.
Not a menu. It's not
yeah,
I don't get to pick myself. Okay.
It's not du jour, no. And they do believe that people perhaps that have unstable housing have difficulty saying that I will be here for the next month, 2 months. They were talking about migrant workers perhaps are going to be single dose only, homeless people that have difficulty getting into appointments or not sure, have more uncertainty. We might just one and done and think that's the best. And we think a vaccine, and we think really all of the vaccines are excellent. Again, all of the vaccines prevent severe illness and death from COVID-19. So we think that's the most important thing. So take what you got and what we offered. You will not be the person choosing which.
Okay. So weight off my mind. I don't have to select myself. I don't have to.
No, we got that. We got that for you. We'll hold that.
So if I'm a person who speaks a language other than English, or I'm assisting someone who speaks a language other than English, we've been pushing that form here in the chat and otherwise. What language is that online form available in? And what languages are spoken at this mysterious call center?
At the mysterious call center. So they can get almost any language on a translator phone, right? So we're able to call in somebody to help with translation services. So if you are having difficulty with that intake form because it's only English in a language, call the number, and they will get a translator on there and they will do it for you. Okay, so they will take care of that. I think it's only in English right now. I do not believe we have English and Spanish. So I think we're only one language right now.
Okay.
For the form, yeah.
Okay, but back to that call center, do I have to be able to speak enough English to get to that point to request translation?
Yes.
Okay.
You do. Yes, you do. Yes.
So it might be good to have someone with me who maybe has more English skills to get us to that point.
Yes.
Okay.
Yes, that's a great question. And usually people can do something, even if you say Vietnamese translator. If you can just have those couple core words, they'll then be able to get a translator on the line. And again, right, there's that patient with humans calling the call center, because then we need to call out to get the translator for you. And that sometimes can take time to capture a translator that can help, a certified translator.
Okay. So when I'm setting up this appointment, or I'm putting in this mysterious form, do I have to set up a MyChart app? Does that have to be part of the process, or can I remain kind of undercover and get an appointment on the phone without having to do that, or another way?
You do not have to have MyChart, but if you're getting it and doing it electronically, yes, you do. But you can go on the phone and just make an on the phone appointment, and you will not need MyChart. But if you're doing it online, you are going to need that MyChart app.
Okay. So let's talk a little bit more specifically. I wanted to talk more about distribution. Then I want to get to the vaccine, some questions we're seeing there, which is, what is the status of the things like CVS, Walgreens, Rite Aid, Safeway, all these mysterious pharmacies I keep hearing about?
So good question. So we are in partnerships with Save Mart, Rite Aid, Safeway, but the only door into them is through this mysterious our form through Contra Costa Health Services. Because what happens is, there are partners, you come in through our door, and then we send you the link so that you can go, and the link will say, we've hooked you up with Safeway. And then you will go to them, and they are our delivery partner. So you cannot and should not be able to walk into Safeway and say, I'm 75, I want a vaccine. You can't do it that way. Not walk in, and you can't call them up either. It has to come through the portal of the Contra Costa Health Services intake form, or the phone number. And the other one, so the status is, yes, they are starting to, the federal government is starting to to think about and test out some partnerships at Walgreens in other states. We don't have that one right here, right now, where it's a direct to Walgreens. And so they're being piloted in different areas. I think there's one in Santa Clara County for the greater Bay Area about a direct to the pharmacy, but we're not there yet. And we're just waiting to see how that goes.
Mm-hmm.
Okay.
And I call that 833 number no matter where in the county I'm looking for. So I could be East County, West County, Central, South, and that's still that 833-829-2626 is still the number I'm going to use. Is that correct?
Absolutely, yes. That's the one number fits all. Absolutely.
Okay. One number to rule them all. I like
yes,
that.
yes, yes, yes.
So what about, like, people have been home for a long time. They're hoping to maybe go see some grandkids or family this year. After being vaccinated, what precautions do they have to take for air travel? So do they still need to quarantine in the same way that we've been talking about, away from people who haven't been vaccinated? What is kind of the process? Is this the double masking? What does this look like?
So best, right, every day, every place, everything, just use those best practices. When you travel, we recommend that you wear a mask. If you can get an N95, we think that's a good idea. If you have glasses, wear glasses. We think eye protection reduces your risk of getting it. So eye protection, mask, a well-fitting mask is what you want. The more layers, the better for traveling. You do not, California actually has not, Contra Costa County has not recommended quarantine upon return.
Mm-hmm.
And so you just need to make sure if you're wearing your mask while you travel, washing your hands, doing all of those things as you go, you're safe. With your people that are outside of your pod, you would then need to wear your mask even when you're at that house, really. It feels funny, but that's the best practice. And when you return to home again too, if you enter into a group with people that are not in your pod, as we call it, we still want you wearing masks. And so those are the best practices. Vaccine, again, if you're vaccinated, we think that you'll be safer. We don't think you'll get severely ill, but we still think it's possible that you could get sick. So you want to protect the others. But air travel is safe, right? On the airplanes, there's great filtration systems on the airplane. So it's hand washing and masking while you're out in public spaces. That's important.
So what if I've had COVID? Should I still get the vaccine?
Yes, you should, because we don't think the immunity lasts as long if you've got it, and we are seeing people getting reinfected with it, and we're seeing the different variants. We haven't talked about those variants. You've heard about the South Africa and the UK. I think there's a California variant now that we have. So there's little variations on the original COVID, and so you might get a different variant of the COVID-19, and we think that the vaccine actually is largely protective for those as well. So yes, if you've had COVID-19, we absolutely want you to get vaccinated. You get through your isolation. So let's say you got COVID-19 11 days ago. The only reason we wouldn't want you to get vaccinated in those 11 days is so you don't get the other people sick, because we want you to keep isolating. So on day 12, go get your vaccine if you can.
Right. Important.
Yeah, it is important. And then we'll ask you some screening questions, because if you needed a special treatment for it, they might tell you need to wait for 90 days. And that's only if you got this biologic treatment. And that's only not because it's unsafe, but because, again, the vaccine won't be as potent and might not be as effective as we want it to be. So it won't hurt you, but might not work as much as we want it to.
Okay. So tell me again, I get the first dose of the vaccine. Sort of what's that percentage range of protection?
So we think the longer you go out from the vaccine, it ramps up, right? So we think about even before you get that next vaccine, you might be close to 85% protected after that first vaccine. And that's closer, like right before you get that second vaccine. So it's ramping its way up as you go along.
So I get that second dose. Yeah. And then a couple weeks after that is when I reach full superpower, like, protection, right?
Superhero, absolutely. 95%, 2 weeks after. We think it's about 2 weeks after and beyond that you have that full protection of the vaccine. And again, I don't know if I've been doing these enough. You could still pass it, because if somebody coughs on me, I've been vaccinated both times. So I think that I might be at that 95% protection rate. but let's say I'm next to somebody, they give me a cough, I didn't have my mask on, I might be able to harbor it. And we know that that virus can divide and replicate for about 7 days. So it might be sitting there trying to get me sick, but because I've got that superpower, it can't. And I might give a little sneeze and might be able to pass it off to somebody. And so that's why I still need to wear a mask, and I still might be able to pass it on to somebody. So you want to make sure that even though you've been vaccinated, even though I'm not going to get sick, I might be able to harbor it a little while. So that's why I'm wearing my mask and minding my fomites is what I'm doing.
Yeah. But Heather, what if I have severe allergies? Do I still want to get the vaccine?
Totally want to get the vaccine. Absolutely. Sneezing, sniffing, everything. Yeah. Because the vaccines, you're talking about seasonal allergies and all of that. Absolutely. Because the vaccine does not affect you because you've got seasonal allergies. The allergy and the allergic reaction that we've seen is something more to do with somebody gets severe medication allergies. And those are the ones that we ask those screening questions, but seasonal allergies, all of that, go get vaccinated. It will not affect you. That's not the kind of allergic reaction we're worried about. And all of the sites will always monitor you afterwards. If you're a person that has and uses an EpiPen because you've got those severe allergic reactions, take it with you to the vaccine site just as a little ounce of prevention. But we're not really seeing that's necessary. But absolutely, absolutely. Seasonal allergies, we don't worry about. Right. Not to dismiss you, but it doesn't worry.
Also, or like I've had an adverse reaction to other vaccines. I have an allergy to eggs. What about those kinds of bases? Because you've talked before about this. mRNA is different. It's not in that same way. So should those issues still be of concern?
Eggs should not be a concern because we would grow like the flu vaccine and these other vaccines, they would grow in this egg medium. So if you had that sensitivity, we would, that's what we would worry about. But this is not grown in that. There might be with the Johnson & Johnson, AstraZeneca, we might have a little bit more of a reaction, a little more soreness, those things at that time. But even if you had reactions, we still want you to get the vaccine, and you might be at one of those monitoring sites when you go in to get it. So we have the tools and everything like that to be able to monitor you the time of the vaccination. Okay, but vaccines, yeah, you should be safe.
Yeah.
Okay,
so Heather, I'm special though. And I'm that 94% effective rate. How do I know I'm that other 6% that I cannot be vaccinated? You know what I mean? Like, how do I know I'm not going to get the vaccine? And then it's just not working for me.
So how do we not know that it's, well, we do have cases of people that even after the 2 vaccines, they've gotten sick. So that can be anybody. Nothing's 100% safe, but you know what? You're still going to have some protection. And you're still not going to get as severely ill as you might have gotten had you not had the vaccine. So even those 5%, they can, because that's only 5 that are going to get COVID-19. The 95 aren't going to get it at all. So only 5 are going to get it, and those 5 still aren't going to get severely ill, and they're still not going to die from it because they've got a little bit of the protection from it. There's no harm in getting the vaccine. There's absolutely no harm in getting it, and it will still provide some protection even if you get COVID-19.
Okay, but how long is it going to last? Am I going to have a booster next fall, next year? What's that situation looking like? Is this just going to be like my next annual flu shot?
And so we don't think it's going to be, well, so like this is kind of up in the air. So all of this is what we say it's evolving, right? We're learning more as we're going along, and especially with these variants on what we've got right now. So we think that probably for the first few years or a couple cycles, we may need a booster shot. And so because this one hasn't been a one and done, there was a previous coronavirus that was here and gone, but this one's not that way. This one's trying to survive. And so that's why it's mutating and has these variations. So yes, probably we're going to need boosters, and they'll probably be able to, with a little more time, find one that's kind of a more broad coverage, but we might not need it forever. So possible that it needs to be yearly or every few years. And so I think we need to kind of prepare ourselves that, yeah, we might need some boosters every year or a few years for a while. And that's okay. It's okay.
So what if I'm a person who has low immunity because of a disease treatment? What is sort of the interaction with the vaccine in that instance? Is this something I should still consider?
So yes, you should still consider. So if you're, let's say somebody that's on chemotherapy, or you're on chronic steroids or something like that, and this kind of goes to that idea that your body might not be able to mount as robust or strong an antibody response. So it might not be able to protect you as much as we would like it to, but it's still going to be able to provide some protection. So this is maybe one of those things where you talk to your doctor about it, but you really need your chemotherapy. So we don't want you not to have chemotherapy because that's a necessary treatment. So it might blunt a little bit the response to your body's response to it, but it's still necessary to get it. So there could be timing. You talk to your oncologist and say, listen, I want to get the vaccine. And they might help you time it a little bit when the best time is to get that vaccine so that your body is able to mount a response to it. But we definitely don't want you to have cancer, be ill, and get COVID-19. So that's why it's still important to get the vaccine, because an ounce of prevention is better than the cure, right? Or not better than the cure, but it helps not need a cure.
An ounce of
right?
prevention might keep you alive, I think is really what we're trying to say. Yeah.
Exactly right. Yeah. So get it, even though and definitely that's one of the screening questions. And so it's for you to know that you might not have the 95% protection, but a little bit of prevention is so important. Absolutely.
So you've talked a lot about your body being able to mount a defense, and you've explained to us that basically what the vaccine does is it enters our body and it tells our body to be like, hey, see this crazy protein spike little thing? Yeah. Remember that for next time and start fighting sooner. Don't wait 3 or 4 days to mount a defense. You start right away. But we keep hearing about these variants. And I want to say to the team, they scare me too. How does the variants fit into this whole thing? And if I've already been vaccinated, do I already have my armor against these variants? Like, what does this mean?
So we think, yes, you do, because at least your body's familiar with it. And I think it's almost like languages. So, some people speak Portuguese and they speak Spanish, and like you can go defend yourself. Like I can speak Spanish great, but I don't speak Portuguese that well, but I'm still able to defend myself against, right? Somebody kind of communicate with it. And so it's kind of that way. It's like, okay, I've seen this before. I know what to do with it. I can manage this. And so right, when we say 77, we think that prevents it, right? So we think most likely it's going to prevent it and most likely keep you from getting severe illness. So even though you had this other virus, your body doesn't know quite as well how to combat it. It will combat it. And then it's going to build that immunity to that one too. So you've got the regular immunity, and then you've been exposed to this variant, and your body's like, oh, I think I'm going to do that. And so it's even going to build its own separate type of immunity to this other one. And we still think that it's very effective. People may more likely to get it, but they're still not getting severe illness and they're still not dying from it. So we're excited about that still. So yes, absolutely. It's going to protect you. You might get it, but you still won't get it as bad. And your body's got a little more protection.
Right.
Okay. Did that explain that, do you think?
It does. No, I totally appreciate that. If you could use your same sort of crystal ball to talk, do you have any idea as to when you think maybe children might be vaccinated, or what that looks like?
So 16 and under were not studied, right? 18 and over, and that's about consent and all of those things. You've got to be able to consent, and like when you do things on kids and everything like that, parents sending their kids into these trials, it's just a little more emotionally fraught. And so I know they're doing clinical trials right now. So I think that they're hoping that they're able to get enough people into the data group to be able to do something in the next 6 months. But we don't know that, right? It's all about the number that they can get a big enough study group that they can say, we've looked at 10,000 kids, 16 and under, and this is what the study tells us it's safe. And they're looking at really, because we know it's safe, they're trying to figure out, do we give them a 0.5 milliliter or do we give them a whole milliliter? Do we give them a 1/4 milliliter? So they're trying to figure out what the dose is. And just imagine you send your children in for that type of, participating in that clinical trial. And so it's going to take a little bit longer, not because it's unsafe. It's just we need to be able to see it with enough people to know what's best.
Okay. So I want to steer us back to the process of getting vaccines again. And the question is, if I have a client and I'm calling for them to get them set up for an appointment, do I need to be their official named responsible party? Or can I just be acting on their behalf and have them there with me?
So they need to be able to give consent, right? They need to be able to say, Nicole Howell is here working for me. You can, if you're doing the form, like a lot of times it doesn't require somebody completely to do that. So you can fill the form out and everything. You can do it as their proxy. If you're on the phone with somebody, we do have ambassadors that are able to call and make the appointments for you as well. So yes, you could act as a proxy for somebody else. You could absolutely do the whole thing for your parents, somebody else, absolutely.
Okay.
As long as you've got all of the information. So you don't want to put in half the information, because when they show up for the appointment, you need to put in the information that they're going to get, because they forgot their photo ID or something like that. So they're going to need to be able to validate, yeah, this is my birthday, this is my address. So you want to make sure that the information that you're putting in on their behalf is the information they might put in or give if they forgot their ID on the day they show up for their vaccine. Yeah.
So as a provider, as someone who's working with seniors, what information do I have to fill out the form for them? And is there a place that I can get a listing of that so I know what I need to pull for them ahead of time?
Well, that's a great, so it is on the form. So it's going to be their name. Let's see, am I able to do this? It's going to be their eligible to get vaccinated. So so this is just the question they're going to ask all of these things: your name, your date of birth, your email address. We haven't talked about this. They're going to ask you about your street address, right? And if you don't have this information, that's okay. If you
what do I put in the field? If I don't have an address, what do I put in the field? Just leave it blank?
Yeah, prefer not to say. So they're giving that option of prefer not to say, prefer not to answer. So they're giving you the option of saying, I don't want to give this information. The required are your zip code, the city, the street address. You can say homeless, right? They would like a zip code, like if you're homeless in West Contra Costa County. That helps us more for zip codes. And so you can say homeless, cell phone if you've got yours. If you don't, use somebody's and it's not required. See, it's not required here, cell phone number. Enter email address if you've entered that in. If you've got somebody else's, but they are, because this is a link to get back an email address, then you're going to need to have somebody that partners with you that helps you do that. So these are the required fields and information that you would need to put in. Okay.
Okay. So we're getting ready to close out. I want to thank you, Heather, for doing 2 of these for us. We so appreciate it. Your expertise and reassuring manner has really helped us all during a crazy time. I want to remind everyone that we have been recording today's session, and Heather we will share that along with Heather's slides with everyone in the next 24 hours or so. We encourage you to share this with your other team members and staff who were not able to attend today. I think before we close out, I also just want to say that I personally, and in my organization, we strongly believe in the vaccine. My Contra Costa employees who are in facilities are right now in their second dose sort of process. I myself have received the vaccine because we go in facilities. And I want to say I do believe in this, and I appreciate that there are healthy concerns, but I want to ask you to look to really healthy, clear scientific sources as you are making this decision. And so I hope that you will all make a good decision for yourself and the people that you serve. Look out for future events like this. Heather, thank you so much. I wish everyone a wonderful afternoon.
Thank you.
Thank you.